I want to share a story with you.
Tell them to be quiet.
I want to share a story with you about passion, persistence, and patience. A story that affects all of us. Most of us weren't around when the story happened. Some of the people are. It's a story of people who saw a need and did not stand by and wait for a solution, but made the solution happen. They're all ordinary people who built relationships, made connections, and created change, not for the good of themselves, but to improve the health care in Maine. As I share this story, please remember that it happened more than 20 years ago. Perspectives and attitudes have changed since then. Many that opposed independent practice for nurse practitioners then may now have very different attitudes. This is a history, and we must be careful not to make judgments, but to learn from the history. It can help us to open our minds in the present, to being open to new and different ways of seeing things. And it can help us to build relationships, not to form divisions. From the inception of the role of the nurse practitioner in 1965, advanced practice nurses in Maine were regulated only by the Nurse Practice Act. During the years prior to 1985, nurse practitioners simply practiced under the Practice Act. They completed their training and they went to work. There were no guidelines for supervision or delegation, and they practiced as they were educated. In 1985, the Maine State Legislature passed a law amending the Nurse Practice Act, which read, medical diagnosis or prescription of therapeutic or corrective measures when those services are delegated by a licensed physician to a registered nurse. And then it went on to say what they could do, but it's established delegated practice. The legislation included rulemaking by the Board of Nursing, and this was the first legislation in Maine affecting advanced practice nurses. The Board of Medicine also regulated physicians supervising nurse practitioners in their Chapter 3. These rules, this was called Rules and Regulations for Physician Supervision of Physician Extenders. These rules limited the number of physician extenders, either PAs or MPs, to 2 per physician. A physician could only supervise 2 different nurse practitioners or PAs. They also were required to sign every single medical record within 5 days of the patient visit. There was also a requirement in the rules that physicians not be present where the physician extender was working. In fact, many nurse practitioners worked alone in clinics where no one else wanted to work. They were filling a need. Many nurses or nurse practitioner employers were paying physicians to come out to their practice simply to sign the charts to fulfill that delegated practice. And if you had more than 2 nurse practitioners, you needed another physician because they could only supervise or delegate to 2. In 1987, the Board of Nursing went out seeking advanced practice nurses to help write the rules directed in this 1985 legislation. 3 APNs responded, or many responded, but 3 were Pat Philbrook, nurse practitioner, Donna Coughlin, a certified nurse midwife, and Alfreda Mulan, a nurse practitioner who are here with us today and still practicing. They met with the Board of Nursing, and these women met weekly, feeling a sense of urgency to write these rules for nurse practice practice. Their aim was to have a collaborative practice rather than a delegated practice with physicians, so they could practice autonomously in many settings, and the physicians were just signing their records. Well, the APN group of Donna and Pat and Alfreda wrote their rules, and the Board of Nursing didn't accept them. They didn't like them. They said it didn't follow the interpretation of delegated practice from the 1985 statute. So the board went and rewrote the rules on their own. These 3 continued to meet with the Board of Nursing and the Board of Medicine, and at the last meeting they said it had to be delegated practice. They said at that final meeting, if you wanted to practice independently, you'd have to change the law or go to medical school. Well, Pat Philbrook states this was a big turning point. The Chapter 8 rules did not support APNs working autonomously, often alone in clinics, providing safe and quality care. Nurses recall Pat saying, then we'll just have to change the law. This is what Pat Philbrook and Donna Coughlin set out to do. A coalition was started by Pat and Donna called the Coalition of Nurses in Advanced Practice, a group of APNs chaired by Pat. Coalition members included nurse practitioners, clinical nurse specialists, nurse midwives, and nurse anesthetists. They came and worked together. The Maine State Nurses Association opened their doors for meeting space, and they met weekly after work, once a week. MSNA typed up their minutes, mailed out their minutes, helped produce flyers and mailings to solicit support. The Maine State Nurses Association set up a phone bank and made their office staff available for help, all at no cost to the APNs. The group met weekly after a full day of practice, and there were an average of 18 advanced practice nurses coming together once a week. As Pat says, this was a diverse group of 22 people strong, strong-willed people, yet we always came to consensus. Led by Pat Philbrick and Donna Coughlin, they studied how a bill becomes law. Kathy Vazina was a pediatric nurse practitioner newly out of law school, and Penny DeRaps talks about Kathy and Penny on the floor of Kathy's new law office writing the legislation for nurse practitioner practice. A fundamental concept was to eliminate the need for physician signatures on every chart and for physician delegation, and allowing nurse practitioners to practice to the full scope of their training. The attempt was to write legislation everyone could live with. We were just regular people who loved what we did and knew we couldn't do it with the current law, said Penny. Now, finding a sponsor in the legislature was not an easy process. They wanted to find someone with clout, and the APNs all asked their own legislators to sponsor the bill. And they heard responses such as, "I like you ladies, and I like my doctor. Don't put us in the middle." Or they'd say, "If you want to practice medicine and go back to medical school, become a doctor." Only one person, Senator Dale McCormick, was willing to sponsor the bill. Senator McCormick went where no other legislators were willing to go. She met regularly with these APNs to plan and strategize. She was committed to this legislation. In 1993, during the first session of the 116th Maine Legislature, LD 1185 was introduced, and it was titled, "An Act to Provide Greater Access to Primary Care by Redefining the Practice of Nursing." The title was chosen because even the Maine Medical Association, a leading opponent, had stated there's a shortage of healthcare providers in Maine. The bill was introduced and referred to the Business and Legislation Committee. Once introduced, opposing calls to legislators came in on a 4-to-1 basis in opposition, 4 opposed to 1 for. Nurses rallied together, though, to support the bill. The coalition continued to meet regularly. They set up a phone tree to make calls. When people needed to be notified, the message cascaded down the phone tree, with each person having a list of others to contact. Remember, there was no email, text messaging, cell phones at this time. Letters were sent by MSNA asking RNs to call their legislators and support the bills. And even among nurses, and even among advanced practice nurses, there was still opposition to the bill. Others supported it but felt too intimidated to call their legislators. Nurses went to the State House to lobby. These were ordinary people, not experienced lobbyists. They were more comfortable in an exam room than in the Capitol hallways. Penny DeRaps said, "I don't like lobbying, but Evelyn dragged me to the State House." The nurses knew which representatives they wanted to talk to, but weren't sure how to identify them. A key relationship they developed was with the Sergeant of Arms at the House of Representatives. Evelyn had told Penny, "See that guy there? Tell him who you need to talk to, and he'll find them." And when the session ended, as people were streaming out of the House chamber, the Sergeant at Arms would stop the member and say, "These nice ladies would like to talk to you." APNs continued to build support with legislators, and slowly, and with compromises, support for the bill grew. The first Nurse Legislative Day was held at the Hall of Flags with RNs and APNs present. APNs believed in this bill. Though not perfect legislation, the goal was an effort to get something passed. It was a huge step in the minds of legislators and lay people to think that nurses could work independently. The mindset of nurses taking orders from doctors was challenging to change. APNs, though, used a nursing strategy for their lobbying. They were assessing, building relationships, educating, and evaluating, using the nursing process approach. Rather than push their legislators to support the legislation, they'd contact their legislators, ask them what they knew about LDA 1185, educate them about who APNs are and what they do, and then they'd go back later and say, "What do you think?" They encouraged support through relationship building and education. Legislators did not just hear that these nurses wanted to pass a bill. They had a relationship with the nurses, and they learned about advanced practice nursing. The Maine Medical Association, on the other hand, spent money and hired lobbyists to oppose the bill. They asked their legislators not to support the bill. They had their staff call legislators to oppose the bill. They were confident LD 1185 would not pass. APNs asked sympathetic physician colleagues. They even begged them to testify in support of this bill. There were 6 physicians willing to testify in person, and several others sent in written testimony. Through some political feats of the MSNA lobbyist, Linda Smith Dyer, the hearing was scheduled on the best day and time for those physician supporters to attend. There was standing room only in the committee room. Senator Dale McCormick stood up and testified in support of her bill she was sponsoring. Before anyone else could testify, the fire alarm went off, and the building was evacuated. They stood outside for hours, and when they came back in, the hearing had to be postponed. It was rescheduled for a different day, and this time the physician supporters were not able to attend in person. Many APNs took time off to testify. Evelyn Keltica testified in 1993, sharing how the relationship with nursing and medicine has changed over the years, where nurses do things now that have previously been thought of as medicine. There was a time when only physicians could take a blood pressure, she pointed out. She shared how nurses in the family planning system would see supervising physicians on the average of once a month, and they were providing safe and quality care. And she pointed that nurses were actually training physicians in some areas, such as when Norplant hormonal rods came out. In the previous year, a nurse practitioner provided statewide training for physicians in the surgical technique of insertion. The concern of patient safety was often brought up by opponents. One physician got up and testified against the independent practice bill on the grounds that NPs can't be entrusted alone to take care of patients. Next to testify was Penny DeRaps. She then followed this physician on the podium saying he left her in charge of his patients when he went to his golfing vacation in Scotland. The coalition of APNs put forward several amendments prior to the end of the legislation, trying to increase the comfort level of physicians and legislators. The bill became very cumbersome. It established a tier system of APN practice with 3 levels of practice that included you were either under delegation, supervision, or collaboration based on your APN education and experience and employment setting. This would have put Maine as the only state in the country where all APNs were not practicing at the same level. Following public hearings and some work sessions, the Business and Legislation Committee voted to carry the bill over to the next regular session. They directed a task force consisting of the Coalition of Nurses in Advanced Practice, the Maine Medical Association, the Board of Nursing and Medicine, members of the legislature, and other interested parties to meet and work out their differences in the bill. And that they did. They had regular meetings over the summer. Key legislators were present, and at these meetings, the APNs had varied strengths. They all worked together as a team. They told me about these meetings, speaking of Kathy Vazina as the voice of reason. She was the NP and the attorney. Evelyn Keltica wore the pink sweater and pearls. She knew how to dress up. Pat Philbrook sat between Evelyn and Penny because you never knew what she might say. Legislators on the task force wanted more information about the nature of advanced practice nursing before agreeing to changes. The coalition members introduced several documents defining common terms, establishing a typology of primary care provided by nurses in advanced practice. Concerns could be brought up by the Medical Association, and nurses would always come back to the meetings with documents responding to each concern. By September, after several sessions, the task force reached a tentative consensus about the nature of advanced practice nursing and collaboration with physicians. The task force met again on October 19, 2013 at Maine Medical Association headquarters, and the Board of Nursing introduced some new language at this meeting defining advanced practice, reflecting things in other nurse practice acts, and then things began to unravel. The medical community brought new participants who hadn't been at previous meetings, and much of the time was spent explaining things to these new participants. The physicians present disagreed with one another. The physician groups could not agree on a decision, and the meeting adjourned. At the November meeting, chaired by the nurse practitioners, the physicians said they were unable to agree upon establishing collaborative practice as had been agreed upon in September or independent practice. The physicians group said they had voted to support the status quo and to no longer negotiate. The dialogue was finished. At this point, Republican Representative Rob Cameron was present, and he stood up and said, "I've had it with you physicians. You've blocked everything. These ladies have worked in good faith all summer. I'm going back to the committee and tell them that this ought to pass." He now became an ardent supporter of this bill. The Business and Legislation Committee voted the bill out 8-3 ought to pass. Tireless lobbying continued by the APNs as the legislative session was nearing adjournment. A memo by Pat Philbrook at this time said, "The Senate vote is very close. Leave this message on to the following senators. I'm an NP. Please vote for LD 1185 with Senator Chinquette's amendments." And a list of senators followed. Pat Philbrook continued on in the memo, "We need bodies to lobby here in Augusta." LD 1185 was passed in the House in its amended, watered-down version with a vote of 84 in favor, 47 opposing, and 20 absent. The Senate vote was going to be closer. The Senate Majority Leader was a Democrat. It was Senator Dutremble, and he supported the bill, and he pressured every Democratic senator to vote in favor of this bill. Now, Senator John Baldacci was on the Senate at this time, and he was planning to run for U.S. Congress after his term was up. He didn't want to alienate the physicians and support the bill, but he was pressured by his leader to support it. So at one point, Senator Baldacci left the Senate floor, apparently to go to the restroom. At that point, Senator Tremble called a roll call vote. Senator Baldacci, being out of the room, never voted. LD 1185 passed on the last day of the legislative session, close to midnight. The bill was never supposed to reach the governor's desk. It was not supposed to pass. Against all odds, with passions, APNs learning and working the legislative process, doing it in unique ways to nurses, building relationships and sharing information, LD 1185 was approved and enacted by the legislature. The excitement didn't last long. They clapped like that, but it didn't last long. Just about an hour later, at 1 o'clock in the morning, Governor John McKernan, Jr. vetoed the bill. As he vetoed the bill, McKernan stated, "While I appreciate the support the work performed by nurse practitioners, I cannot support a bill which changes the legal relationship between nurse practitioners and physicians without also changing liability standards which govern physicians supervising nurse practitioners. Under the language proposed, physicians collaborating on an ad hoc basis with nurse practitioners will be subject to the increased liability risk." The governor's veto was sustained easily in the Senate with 19 in favor of the veto, 15 opposed. Gordon Smith, Executive Vice President of the Maine Medical Association, wrote to his members April 14, 1994, saying the bill was dead and that we could take some pleasure in the victory, but clearly we need to be thinking about the November elections and next January, as the nurses will surely be back and be feistier than ever. There was disappointment among the APNs, and they regrouped, and they were feisty as ever. Pat Philbrook sent out a memo on December 19, 1994 to the coalition members saying, "Presently there are 5 avenues we're working on. 1, new legislation. 2, healthcare reform. 3, rules and regulations of the Board of Nursing and Board of Medicine. 4, meeting with other nurses. And 5, meeting with the public. Clinical nurse specialists have joined us. I love unity." The coalition continued to meet regularly and began the process. With the assistance and support of legislators of LD 1185, such as Representative Stephen Rowe, LD 948, an act to provide greater access to health care, was written. The Board of Nursing looked at the bill and thought they could do some better statutory language, so they actually rewrote the bill with some better language. The bill did not include collaborative practice. It was a statute to license and allow APNs to practice without supervision of physicians or delegation by physicians. This time, the coalition also decided to hire a professional lobbyist. There was no organization. MMPA didn't exist. There was no political action committee to support this. Just a coalition of about 22 APNs who had a lot of energy and passion. They hired Linda Smith Dyer. She was good. She knew her job. She was respected by legislators, and she knew how to connect with Republicans, something that was needed as the legislation would need to win over Republican legislators. Linda also felt passionate about this legislation. Kathy Bazina recalls Linda Smith Dyer brought a lot to the table. She told us what different people needed to hear and found the right people to go talk to them. A challenge, though, was they had to pay Linda, and she negotiated a discounted rate of $15,000 for the session. This was an excellent price at that time, but there was no treasury, no funds, no dues. Coalition members were asked to contribute, and they began writing checks. "We believed in it," these nurses would say, and using MSNA facilities, letters and calls were sent and made to nurses all over the state requesting financial support. Contributions were received from $5 to $500, and the full amount was eventually collected. As the coalition prepared to introduce another bill, leaders Pat Philbrook and Donna Coughlin realized they would not be the best APNs to spearhead this bill through Congress. They said the cause would be better served with different people, and Penny DeRaps and Evelyn Celtica were selected to lead 948. Philbrook and Coughlin continued an active role, but for political reasons, they played that role off center stage. In fact, for political reasons, Pat Philbrook refrained from even entering the gallery of the legislature during hearings until the final days when they were sure the legislation would pass. Serious thinking went into who would sponsor the bill. Senator McCormick was supportive, but encouraged a different sponsor, someone that could connect in different ways with legislators. There was more support among legislators this time, and more legislators that would be willing to sponsor the bill. The newly elected governor, Angus King, was an independent, and the Senate had one independent senator, Jill Goldthwait, along with 17 Democrats and 17 Republicans. Goldthwait's other strength was that she's a nurse. A group of APNs met with Goldthwait to interview her to see if she'd be appropriate to sponsor the bill. And immediately her commitment was evident and the work began. The bill was co-sponsored by Senator McCormick, 5 other senators, as well as 7 representatives. The legislation was much stronger, eliminating the collaborative practice clause that was in 1185. The other issue would be assuring support of the newly elected governor, Angus King. While campaigning for governor, King said how he felt, quote, compelled to address LD 1185, stating he fully supported the goals of legislation to improve access for Maine citizens to primary care. He was clearly quite familiar with the bill and said that as governor he would, quote, encourage interested parties to work together. When the legislation was resubmitted, the APNs began building connections with Mr. King. Once elected, Louise Davis, a psychiatric nurse practitioner who was a personal friend of King, and her husband, a lawyer, also was roommates with King in the past. And Louise would walk by the governor's office to chat with him informally. Donna Coughlin also met with King's wife, Mary Herman, a nurse, and lobbied her on the bill. Governor King called the APN leaders to his office at one point saying he would support this legislation, he would sign it, however it came to him. If it was in favor of nurses, he would support it. If it wasn't, he would still support it. LD 948 was introduced to the 1995 first session of the 117th Maine Legislature. When we got to 948, we were slick, DeRapp said. We knew what our problems were, we knew who our enemies were. The APN stood firm, moving the bill through the process. They had experience and had established relationships with many legislators. Vecina said we had become sophisticated. There were 2 to 5 nurses at the State House every day. These APNs were coming on their days off from work or taking off days off work to lobby legislators, testify at hearings. They had a sophisticated phone tree to contact each other, and Evelyn Celtica would fax schedules weekly listing who would be there and who they needed to contact. Much of their work was talking to legislators to assess where they stood on the bill and directing their resources, their human resources, at the ones that were not fully supportive. During the hearing, CRNAs and CNSs decided not to include themselves in obtaining prescriptive authority in this bill. The bill was heard by the Business and Legislative Committee chaired by Stephen Rowe. As the committee held hearings and worked the bill, Rowe wanted to be sure that a seat on the Board of Nursing went to an advanced practice nurse. To add a 10th seat to the Board of Nursing would add a fiscal note to the bill, and to do that would mean it would also have to go through the Appropriations Committee and also be approved one other place, which wouldn't be as probable. So Rowe proposed that they replace a licensed practical nurse on the board with an advanced practice nurse, maintaining the 9-member board, 9 members on the board, and not creating a fiscal note. The bill came out of the committee with a divided vote, 8-4, ought to pass. This meant that there would be debate on the House and Senate floors. In the House of Representatives, 4 different amendments were introduced to the bill after the first vote. These amendments included everything from requiring APNs to tell patients that they were not practicing with physician oversight and a $100 fine if they failed to do so, to requiring a 36-month supervision for advanced practice nurses to practice independently, and then a couple with small wording changes. If any of these amendments were approved, the bill would have to go back to the Senate for another vote. Unfortunately, all 4 were defeated. On June 26, 1995, there was intense debate on the floor of the House prior to the final vote. Representative Stephen Rowe, chair of the Business and Legislation Committee, gave passionate testimony speaking 3 times in support of LD 948, stating that of all the 90 bills before our committee, I consider this to be the most important and will do the most for the citizens of our state. Representative Rob Cameron, a Republican, staunchly supported the bill, sharing, "The issue is not medicine versus nursing. The issue is allowing highly trained professionals that are residents of this state to practice to the fullest extent of their education." Cameron pointed out that the same people supporting collaboration now, that is opposing this bill, were the ones that opposed last year's LD 1185, every single one of them. Cameron also noted that though the debate was all about independent practice, the words independent practice were not even in the bill. There was more testimony in opposition to the bill, but the APNs had done their work and they knew they had the votes needed to pass the bill. LD 948 was enacted by the House of Representatives with a vote of 83 for, 60 against, and 8 members absent. The Senate vote took place on June 28, 1995. There was less debate than on the House floor. Many people remember a lengthy testimony by a senator who was also a pediatric nurse practitioner against the bill. Bill sponsor Jill Goldthwait gave a brief testimony near the end of the debate, alluding to the extreme exaggeration opponents had used in their testimony, stating, "I was half expecting an amendment that said that nurse practitioners can only fish 1,000 traps, because that's about the only thing that has not been done to this bill. We have now brought into it abortion into question, and next I presume that this will allow nurse practitioners to clear-cut forests and kill dolphins." It's in the legislative record. A final vote was taken with 19 in favor and 16 opposed. The bill was enacted and sent to the governor for approval. On June 29, 1995, the night before Governor King was to sign the bill, there was a celebration at the Senator Inn in Augusta. APNs and legislators attended in such large numbers they had to ask the restaurant for more food. It was the culmination of over 4 years of work. Celtic recalls, "The veto of LD 1185 was the best thing Governor McKernan did for us. LD 1185 was so watered down and weak, and the veto, along with the persistence of APNs and the support of legislators, led to a much better bill." Many sacrifices were made, money, time, and personal. Our colleagues gave of themselves to meet together, to build relationships with senators, and to advance the process. During the process, Donna Coughlin went through her second divorce. She was a single mom, her cancer returned, and she died shortly after LD 948 was signed. Things were not yet finished for the APNs. Next came the process of rulemaking for LD 948. The legislation set up a joint council on advanced practice registered nursing consisting of 4 members, 2 members of the Board of Nursing, 1 from the Board of Licensure of Medicine, and 1 from the Osteopathic Board of Licensure. The legislation stated that, quote, "the members must be guided by the best interests of the general public and not by the interests of their own profession." Other interested parties, such as Pharmacy Board, sent comments to the council. There was concern expressed by the Board of Medicine about the, quote, "unrestricted practice of medicine to APRNs." There was talk about prescription formulas, collaborative practice agreements, dispensing of drug company samples, and more. But after many drafts, rules were developed without a formulary, but with authority for prescribing anything except for scheduled drugs. LD 948 was enacted in 1996. As Representative Cameron said in his testimony, the bill did not include the words independent practice. The bill simply allowed certain registered nurses to be designated as advanced practice registered nurses authorized to practice certain drugs and devices. To do this, there was no requirement for supervision, delegation, or collaboration. The way APNs practiced after the legislation was not much different than before, consulting, collaborating, and working together with other healthcare professionals. The big difference is that there was no formal agreement or affiliation with physicians required for licensing. Semantics are important. The word independent scared many people. None of us practice independently, even if you own your own practice. We work together, consulting, interacting to give the best care to our patients. I suggest we should use the term autonomous practice and refer to the legislation as independent licensure, allowing us to practice to the full extent of our education. The Coalition of Nurses in Advanced Practice gave birth to the Maine Nurse Practitioner Association. These APN colleagues that worked so hard were the midwives of this organization. Through MMPA and continued investment by nurse practitioners in their profession, many more steps were taken to improve NP practice in Maine. In 1996, under the leadership of President Penny DeRaps, rulemaking was changed to allow prescription of scheduled drugs. APNs went back to the legislature, spurred on by MMPA President Evelyn Keltica in 1998, and led by lobbyist Bob Howe to introduce LD 857, requiring direct reimbursement to NPs and midwives by insurance companies. In 2005, LD 1568 was enacted, allowing nurse practitioners to sign death certificates, and in 2009, LD 1598 was passed, granting supervisory privileges to nurse practitioners. MMPA and its active members have been serving all of us, advancing our profession to improve health and health care for the people of Maine. The story's still not over. There's still more to do to improve the climate of health and health care in Maine, and APNs must be at the heart of this. We must invest in our profession with passion, persistence, and patience, as our colleagues did starting 28 years ago. Right now, LD 970, an act regarding advanced practice registered nurse requirements, is before the legislature. The bill provides prescriptive authority for all 4 APN roles and is part of a process to make APN licensing consistent throughout all 50 states. We'll hear more about this later and how you could be a part of it. The best way we can show our thanks for those who brought us to where we are today is to invest in our profession. If you're not a member of MMPA today, then join today. It's a small investment to make for what our colleagues have done for all of us. If you already are a member, tell this story to other MPs and recruit one member. Think of how we could grow our profession if every one of us recruited one new member to MMPA. And the second and final thing is to build relationships and make connections outside of the exam room and the clinic. Connect with your legislators. Find out their phone numbers, their emails, and put them on your contact list. Call them just to let them know who you are, that you're an MP and you're willing to help with healthcare issues should they need anything. Building relationships and making connections were the keys to this legislation, and they will be the keys to transforming healthcare. Nurse practitioners working together, united, can make a difference. I wasn't there when this story happened. I didn't live in Maine, although I'm in awe at the amazing process as I've researched it. I'm just sharing the story today, and now I would like to show our gratitude to the many people who made this story happen. Would anyone now stand up who was part of this process of LD 1185, LD 948, anyone that was around to be recognized?